Hi friends, welcome to the channel. Here we are discussing about AIIMS NORCET 2023 question series. This is 7th part. You can go and watch this our 6 video series, and you can continue this video. If you are not subscribed to our channel, please subscribe. We will start the topic here. That is AIIMS NORCET 2023 video series. So first question. AIIMS NORCET 2023 series number 7. First question. Conditions precipitate the sickle cell crisis into children except dehydration, fever, any type of stress, oxygen administration. Here, correct answer is oxygen administration. Oxygen administration will not precipitate sickle cell crisis, but if it is the oxygen administration is going on in a continuous manner for a prolonged period, it will leads to sickle cell crisis. So I will explain how it is. Prolonged oxygen administration can actually precipitate a sickle cell crisis in children because high levels of oxygen are known to suppress the formation of new red blood cells, while dehydration, fever, and stress are all non-triggers of sickle cell crisis. So, if you are starting oxygen administration, it will not provoke the sickle cell crisis. But if it is continuing for a prolonged period, because of high oxygen level, it will suppress the formation of RBCs formation. Then it will leads to sickle cell crisis. So that is a difference, oxygen administration and prolonged administration, how it is precipitate sickle cell crisis. Second question, easy question. The basic unit of life is the atom, water, the cell, the chemical level of organization. The basic unit of life is the cell. The basic unit of the life is the cell, which is the smallest structure capable of performing all the functions necessary for life. That is why it is called basic unit of life. Third question. Pleura, which lines the thoracic cavity, is an example of mucous membrane, serous membrane, synovial membrane, all. Correct answer, serous membrane. The pleura, which lines the thoracic cavity, is an example of serous membrane, and serous membranes lines the various cavities in the body and secrete a lubricating fluid to reduce friction. So there are you can give an example for other types of serous membrane that lines the abdominal cavity and one another which lines the heart. You can comment it below. Serous membrane, other serous membrane. Then fourth question, primary function of WBC is transportation of oxygen, transportation of nutrients, phagocytosis, transportation of waste product. Correct answer is phagocytosis. The primary function of WBC is phagocytosis, and or phagocytosis means it is an ingestion and a destruction of foreign substances such as bacteria. That means it will ingest the foreign substances inside the that WBC, then it will destroy. Fifth question, the thymus related T cells. The thymus related T cells produce antibodies, produce NK cells, recognize B cells, recognize body's own cells. Correct answer here, the T cells recognize body's own cells. Thymus related T cells are responsible for recognizing and attacking the body's own cells that have become infected or cancerous, helping to prevent autoimmune disease. So that is important. If there is an autoimmune disease, then this thymus T cell attack that autoimmune antibodies and it destroys. Sometimes it will helps to destroy cancerous cells also. That is because of the overgrowth, the cancer cells which will be identified, then T cells will attack that cancerous cell and destroy. Then sixth question, in the following, which is not a hematological disease? Leukemia, MI, MI means myocardial infarction, anemia, polycythemia. Correct answer is MI or myocardial infarction. MI or myocardial infarction, it is an example of cardiovascular disease and not a hematological disorder. Leukemia, anemia, and polycythemia are all examples of hematological disorders. So I think it is clear. Myocardial infarction, it is an example of cardiovascular disease. Leukemia, anemia, and polycythemia are the examples of hematological disorder. Hematological disorder means the disorder related to blood. Seventh question, which of the following is a common characteristic of individual who engage in sadomasochistic behaviors? A history of childhood abuse or trauma, low levels of aggression and impulsivity, high levels of empathy and compassion, a preference for conventional sexual activities. Correct answer here, a history of childhood abuse or trauma. The history of childhood abuse or trauma, that is the correct answer here. Although not all individuals who engage in sadomasochist behavior have a history of childhood abuse or trauma, studies have suggested that there may be a higher prevalence of these experiences in individuals with sadomasochistic tendencies. Additionally, individuals who engage in this behavior may have higher levels of aggression and impulsivity than the general population. So that is a difference between normal people and these sadomasochistic behavior persons. They will have higher levels of aggression and impulsivity when compared to general populations. So they usually most of the times there may be chances of childhood trauma or abuse. So that is about sadomasochistic behavior. Peculiar feature that is the history of childhood abuse or trauma may be there in the case of sadomasochistic behavior persons. So in majority of cases. Then eighth question, the largest cells in the blood that leave the bloodstream to become macrophages are dash. The eosinophils, monocytes, basophils, neutrophils. Correct answer here, monocytes. Monocytes are largest cells in the blood and can leave the bloodstream to become macrophages, which can play an important role in immune defense. So can you name some of the macrophage system in our body? You can start it from our nasal cavity. There are some macrophages in our nasal cavity and in abdominal gut and on the skins. So these are the areas of some usual macrophages locations. So you can comment some macrophages system in our body. Macrophages play an essential role in the immune system by engulfing and digesting foreign substances, cellular debris, and microorganisms. Eosinophils, basophils, and neutrophils are also the types of white blood cells, but they do not differentiate into macrophages system. Only monocytes that will changes into macrophages system. Ninth question, most common investigation during diabetes mellitus: blood urea nitrogen level, chest x-ray, blood glucose level, blood culture. Easy question. Correct answer is blood glucose level. Blood glucose level is the most common investigation during diabetes mellitus, as it is used to diagnose and monitor the condition. Usually with blood sugar monitoring, we can monitor the progress of the disease or progress of the treatment also we can do with the blood sugar monitoring. 10th question, all of the following conditions impair coagulations except liver disease, vitamin K deficiency, severe hypocalcemia, vascular spasm. Correct answer is vascular spasm. Vascular spasm will not lead to coagulation problems. All other options, liver disease, vitamin K deficiency, hypercalcemia. Calcium also, it is an important component in blood coagulations. If there is a lack of calcium level in our body, it will lead to impaired coagulation. Vascular spasm does not impair coagulation, whereas liver disease, vitamin K deficiency, and severe hypocalcemia can all affect the blood clotting ability. 11th question. All are high risk factors for endometrial carcinoma except obesity, multiparity, diabetes, exogenous estrogen. Correct answer is here multiparity. Multiparity or having given birth to multiple children is actually a protective factor against endometrial carcinoma. So that is important here. Multiparity will protect against the endometrial carcinoma. Same time, obesity, diabetes, and exogenous estrogen use all are non-risk factors for endometrial carcinoma. So I think it is clear. Multiparity will protect from endometrial carcinoma. Same time, obesity, diabetes, exogenous estrogen use are all high risk factors. 12th question. Which of these symptoms is typical of advanced ovarian cancer? Amenorrhea, hypermenorrhea, abdominal distension, abnormal bleeding. Correct answer is abdominal distension. So in advanced ovarian cancer, abdominal distension is the commonest symptoms. Amenorrhea, hypermenorrhea, sometimes abdominal bleeding that also may occur, but commonly abdominal distension is the common symptoms during advanced ovarian cancer. Abdominal distension is a common symptoms of advanced ovarian cancer caused by the accumulation of fluid or tumor growth in the abdomen. 13th question. Which of the following laboratory tests is important for patients on chemotherapy? WBC level, RBC level, electrolyte level, or blood urea nitrogen? Correct answer is blood WBC or white blood cells level. Chemotherapy is a treatment that uses powerful drugs to kill cancer cells. So since chemotherapy can also affect healthy cells in the body, patients on chemotherapy need to be monitored for any changes in their blood counts, including white blood cells counts, which can indicate how well their immune system is functioning. So white blood cells, it is an important contributing factor in our immunity. So during chemotherapy, there will be a chance to destroy the white blood cells. So there we should check the white blood cells to assess our immunity level. If it is low, means you have potential risk for infection. So that is why we are monitoring a WBC level during the chemotherapy. If it is very low, means you are exposed to infection easily. Even with your body flora itself, you will get infection. 14th question. Daily output of urine between 100 to 400 milliliter is known as polyuria, anuria, oliguria, pyuria. Correct answer, it is oliguria. Oliguria, that is urine output between 100 to 400 ml. Oliguria is a condition in which the body produces less urine than normal, usually less than 400 ml per day. It can be caused by a variety of factors including dehydration time. There is a chance to occur oliguria, kidney disease. In early kidney disease, there will be oliguria, then it will go to anuria. Then certain medications. So in some medication, there will be a chance for decreased urine output. So these are the causes for oliguria. Same time, polyuria means it refers to excessive urine output, typically more than 2.5 liters per day. Anuria means it is a complete absence or less than 100 ml per day of urine production. That is anuria. Pyuria means it refers to the presence of white blood cells in the urine or white blood cells or pus. It indicates urinary tract infection or other inflammatory condition. Then 15th question. Absent all of the following are major warning signs of cancer except change in the bowel or bladder habit, a sore that heals completely, unusual bleeding of discharge, lump in breast or elsewhere. Correct answer is option B, that is a sore that heals completely. Usually in the warning signs means as a sore that a unhealed sore. That is an example of warning sign in the case of cancer. But a sore that heals completely, it will not include warning signs. A sore that heals completely is not typically considered a warning sign of cancer, as cancerous growth tend to persist and may even grow larger over time. The other options listed. So other options, that is changes in the bowel or bladder habits, unusual bleeding or discharge, and lumps in breast or elsewhere are all potential warning signs of cancers. Then 16th question, which of the following investigation is performed for the diagnosis of pneumonia? Blood culture, chest X-ray, sputum culture, all of the above. Correct answer, all the above options are used. All the above tests are used to diagnose the pneumonia infection. To diagnose pneumonia, doctors may perform a blood culture to detect any bacteria in the blood, a chest X-ray to see if there are any abnormalities in the lungs, and sputum culture to check for the presence of bacteria or other microorganism in sputum. So these are the diagnostic measures for pneumonia. Then 17th question, collapse of lungs tissue is termed as atelectasis, bronchiectasis, tracheobronchitis, pneumonia. Correct answer, atelectasis. Collapse of lungs is known as atelectasis. Atelectasis is a condition in which all or part of a lung collapses, making it difficult to breathe. It occurs when tiny air sacs in the lungs, that is known as alveoli, that will deflate and the lung tissue is no longer able to expand properly during inhalations. Usually after the expiration, alveoli will deflate partially only. It will not deflate completely. But during atelectasis, the alveoli completely it will deflate. It will remove all the airs, and after deflating, it will be difficult to expand it again. So that is a pathophysiology of atelectasis or lung collapse. It can be caused by a blockage in the airway, a buildup of fluid in the lung, or other factors such as infection also will lead to atelectasis. Sometimes it may due to blockage in the airway, or sometimes it may be due to buildup of fluid in the lungs or other factors such as infections. Same time, bronchiectasis means it is a chronic lung disease characterized by abnormal dilation of the bronchi and bronchioles, resulting in chronic inflammation and recurring infections. Abnormal dilatation, that is in bronchiectasis. Tracheobronchitis is an inflammation of the trachea and bronchi, typically caused by a viral infection. Pneumonia is an infection that causes inflammation in one or both lungs, typically caused by bacteria, viruses, or fungi. So that is about today's video. We have discussed around 17 questions here. So if you have any doubt, means you can ask in comment sections. I will try to solve your doubt. And there is a chance to get a doubt in second last question. That is the causative factor or diagnostic test for pneumonia. So that options are blood culture, sputum culture, and chest X-ray, and all other options. So I have given all other options. Sometimes you can exclude the blood culture because blood culture we are used to diagnose the sepsis. It is not typically used for pneumonia. So in that condition, chest X-ray and sputum culture is the diagnostic measures for pneumonia. Okay, so that is about today's video. If you are not subscribed our channel, means you can subscribe and support, and also you can share with your friends. So we will come with another video soon. So till then, please stay tuned with our next channel. Thank you.